Hi, doctor.
Hi,
How are you doing?
I'm good. I'm good. That's good.
Okay. So I was just telling our listeners that today is Friday, and we thought of having this very important topic around sexual hygiene, and this is a topic which is very important, and all of us want to ask about it, but
No
we
one
we
wants
don't
to
know who
talk
to
about it.
ask. Yeah, we don't know whom to ask. So this is a very great opportunity that we have a doctor in front of us to whom we can directly ask about our sexual hygiene. So, doctor, before we start, could you please give bit small introduction about yourself? About like I have not told your name yet, so if you can tell your name and a small brief introduction about yourself.
Okay, my name is Valleri Ramkrishnan. I have done my MBBS and my MD in Gynae and Obs from RNT Medical College, Udaipur, and I've been a consultant with an organization called Parivar Seva Sanstha for more than 25 years, and I also have my own nursing home. So briefly,
Okay.
that's what I do.
Oh, thanks a lot, doctor. And let's just get into the topic for today, sexual hygiene. So, doctor, what is this sexual hygiene, and how is it different from any other hygiene of the body?
Basically, what is hygiene? Hygiene basically means keeping yourself clean, keeping all your body parts clean. So, uh, we don't talk so much about sexual hygiene because it's something very private. It concerns private parts, which at least in India, one doesn't really talk about. So, the knowledge about sexual hygiene is also a little low. If you talk about general sexual hygiene, it basically just means cleaning your private parts,
Yeah.
whether it's the male or the female private parts, which are because they have a sexual role. That's why we call it sexual hygiene. Otherwise, it's just simple hygiene like any other, like washing your hair, washing your any part of your body. So there's not too much of a difference between simple hygiene and sexual hygiene. The only main difference comes into play when sexual activity also starts. So till sexual activity doesn't start, it's just hygiene as hygiene of any other part of the body is, right? So
Yeah.
if you ask me, what is there any major difference between simple body hygiene and sexual hygiene? Not really, not till sexual activity starts, and certainly not till puberty starts. But
Okay.
it's an area which needs to be cleaned. So one should, as one always washes one's hands before while taking a bath. The first thing you wash is your hand. So
Yeah.
before washing your private parts, you need to wash your hands. Um, it's an area where there's hair growth, so you need to keep it even cleaner because there'll be sweat and discharge, etc. During a woman's period, one will have
Yeah.
to be more careful. So the hygiene becomes even more important when the woman is having her periods. So basic difference will be just in those matters,
Okay.
right?
So, yeah. So, doctor, as you said, like people, like after we hit puberty, and if we are sexually active, it's better to take care of your sexual hygiene. So,
Absolutely.
how do we ensure that we have proper sexual hygiene? Like, for example, you said before, doing anything, we wash our hands. So,
Yeah.
like normally we take a bath, and I think many of us think that is enough. I think taking bath and everything is, we have put soap, so everything is fine. So
Yeah, absolutely. Soap and water is the best. The soap and water is the best for hygiene in any part of the body. So whether it's under your arms or whether it's your face or whether it's the rest of the body, similarly, in your private parts, for a man or for a woman, soap and water is best. Too much use of soap is also not really recommended because soap has a drying quality. So especially the female private parts are rather delicate, and too much of that area is not supposed to be completely dry. So too much usage of soap is also not really recommended. The other
Okay.
small point that works for a woman is don't hold your urine for too long. That also
Okay.
comes into part some part of sexual hygiene. So
Okay.
the tendency, if a woman has a tendency to hold her urine for too long, there's a small chance of increased urinary tract infection.
Okay.
Then the third very important thing is, as children also, we teach our children that you always wash from front to back, which means that especially for a girl, you wash your vaginal area first and then you wash your anal area, because uh, any contamination from the anal area of stool can happen in the vaginal area, which can lead to infections. So that is another
Okay.
very important thing that always wash from front to back.
Okay. Okay.
Another point is wearing clean underwears, should be cotton, should be washed daily, should not be shared with others, and avoid using synthetic stuff because it's an area which does not get too much air.
Okay.
So it has, anyway, God has made it a little moist, and so the use of synthetic stuff leads to fungal infections and all, which is true for men and women. So ideally, cotton, clean, washed underwear. Those are the best to be used. In menstruating women, when a girl has her periods, she has to be slightly extra careful. She has to change her pads at least 4 to 6 hourly every day. She should, every time that she changes her pad, she should wash. Some people like to remove their hair.
Yeah.
It's not necessary actually. God has given hair over there for some reason. It's supposed to be protective. It reduces the chances of infection. But if someone wants to, they can trim the hair. Ideally, hair remover creams, waxing is not really recommended. They all irritating and can lead
Oh,
to skin infections, right?
okay. So, doctor, I wanted to ask, like you said, if you want to remove your hair, you can remove or you can keep it. So sometimes women think that maybe because of the hair only I'm getting infection because during my periods, it might not be hygienic. So some people say it's good to remove it. So while removing
Um,
it, we use cream and that might add on to the infection and
all creams, whether they may advertise as natural products, whatever they may advertise as, all creams have chemicals. All chemicals are irritants. So you can never be sure about what you're using. The chances of some kind of irritability happening after using creams, even after waxing, you get folliculitis, which is an infection of the hair follicles. You get lot of fungal infections after using all these things. So uh, it's a question of personal likes and dislikes also. You can trim the hair with a scissor, which should work perfectly. Another
yeah,
point that I would like to add is sanitary pad. Now, most people these days are using disposable sanitary pads. Unfortunately, what is happening is all disposable sanitary pads are made out of synthetic stuff. There is absolutely no cotton left in them. There was a time 20, 30 years ago when the cotton that used to be used was real cotton. Now it's all synthetic gel, which has a very good absorbing capacity. The lining which is covered on top of the sanitary pad is also synthetic, and that leads
yeah,
to a lot of infections. So we come across women who are chronically, they have itching, and they post their periods, they start getting infections, etc. So cloth pad, maybe we're going back to the times of olden days when, they used to use cloth. So now you get good cloth pad, which I would certainly recommend, because they are economically, they work better because they're reusable. They cause much less infection. I think that should work.
Okay, okay. And doctor, the next question is related to few tips to people who are sexually active for men and women both. Like what to do after sexual activity. Like what do we do for maintaining sexual hygiene? Are there any steps like
You
no,
know,
we don't know. We Google it and we find out. Okay, go. Some people say I went and peed. I drank a lot of water. So could you please guide what should a man and a woman do?
um, you basically asking after intercourse, right?
Yes, yes. To maintain hygiene.
Yeah, to maintain hygiene. So the best thing would be just to wash with plain water, maybe lukewarm water, just simple water. It's said uh, passing urine helps because in the women, the it's called the urethra,
Okay,
where the woman passes urine from. That passage is rather short as compared to the passage of a man. So the
okay,
chances of urinary infections are much higher in women. So
okay,
it's supposedly, if you immediately pass urine after sexual activity, the chances of any infection going into your urethra are slightly reduced. It's no short method that you will not get infected if you do this, but the
okay,
chances will certainly reduce. So
okay,
wash with the plain water, pass urine, wear a clean underwear. Ideally, you should change your underwear just after sexual intercourse. For the man, the foreskin should be pushed back and washed with water. Basically,
So,
that's it.
so water would
Apart
work.
from that, sorry,
I mean, water is the answer. Like, just water is
water is
helping.
the best thing. There's no need for any other kind of wash.
Okay,
Or
okay,
another thing is
okay,
no douching. Okay, there was a time, maybe 20, 30 years back, when vaginal douches were recommended. Vaginal douche
okay,
basically is you push in water into your vagina and let it flow out again. So it was supposed to be for cleaning out the vagina, but that
okay,
is absolutely a no these days. Vaginal douching is absolutely not recommended for anything. So
okay,
vagina has to have a pH of 4, which is slightly acidic. And God has made it that way. It will stay that. So we don't have to do anything great to
anything extra
anything very
to
extra.
keep it?
Yeah, absolutely.
Okay.
It will
So,
it will work out fine.
okay. So, doctor, there are a lot of people use
Excuse,
sex toys. Yeah.
excuse me, I forgot to add one thing. A condom. Use a condom. It has multiple uses. Of course, it prevents pregnancy, and if any kind of sexually transmitted disease, if you change partners and not very sure, condom is the answer. So
Okay.
it very much comes under the topic of sexual hygiene.
Okay.
It works for both.
So,
It's protective
okay.
for the man as well as for the woman.
Okay. So condom and water is one of the like simple answers. Just wear condom and use water like normally how we use
Absolutely.
for cleaning. Okay. So doctor, a lot of people use sex toys. So is there any way, I mean, we can clean, is there any particular way of cleaning sex toys so that we can promote hygiene?
Now, sexual toys are made of many different kind of materials. They're made of thermoplastic rubber. They're made of polyvinyl. Mm, Even I've heard, I haven't seen, and stainless steel and uh, rubberized kind of things, latex. So different sexual toys are made of a whole range of materials. Soap and water is the best for them. Women or men should certainly not be sharing among themselves. So if you have a
Sharing
sexual
is fine.
toy, just keep it for
Sharing.
yourself. No,
Okay,
you do
okay,
not share that with anyone. So
okay, okay.
once you've used it, wash it with soap and water, or there are some come with instructions that you're only supposed to wipe with a wet cloth. And some types might need boiling, rinsing. That's
Okay,
it. But
okay,
nothing dramatic has to be done.
okay. Okay, so the main thing out of this I got is we should not be sharing the toy, I mean
Oh,
the sex toys.
absolutely. That's a no, complete no.
Okay, yeah. So people who are listening to this conversation, please, if you buy another toy, do not share. I mean, if you have, I mean,
Yeah,
if there are people, just buy another toy, invest on it. Yeah,
if you bought it, keep it to yourself.
yes. So, doctor, like we get a lot of ads online about this vaginal wash. I mean, intimate wash. Like you can use it, and it's eco-friendly. It is good for the body and adds to some
Aloe
pH. I
vera.
mean, yeah, aloe vera involved.
Aloe vera is
So
very popular.
yeah, and anywhere we read about aloe vera, we think it's good for body, and we just take it because it has aloe vera in it. So, do you think, I mean, addition with water, this vaginal wash would help, or are there, is it necessary,
I
or
I personally think it's an advertising gimmick. Uh, all perfume things, it's all bad.
all perfume?
It's all hogwash, that it has natural products. Have you gone to see whether it has natural products?
No.
No, you haven't.
Yeah.
Almost everything has chemicals in them. And the vaginal area, the penile area is not supposed to, you're not supposed to use chemicals on them. So I would not recommend this to any of my patients.
Okay.
The
So,
pH, the body maintains. We don't
okay.
have to do anything specifically to maintain the pH. And if a woman is really having a lot of problem, lot of itching, lot of discharge and all, she has to go to a doctor. And
Okay.
without some kind of treatment, that's not going to go,
Okay.
right? So just by
Yeah.
using a body wash or a vaginal wash, it's not going to work. So I would
Okay.
say no, absolute no to any kind of washes
Vaginal
and
wash.
the kinds that are available in the market.
Okay. And also, doctor, there are some sprays and talcum powders, like even for boys. I remember in childhood, this Johnson baby powder they used to put for boys. Is it required for hygiene? I mean, for men, I'm speaking about.
No, not really. See, all kind of talcums have a tendency to, when the body is wet, it, it sticks to the body. And then when the body dries, it streaks of it. You'll notice it, if you put talcum on your body just after a bath, and after some time you go and look at the same body part, you'll see streaks of talcum which have stuck to the body. So for men, it's even more important that they do not use talcum, because if talcum gets stuck under the foreskin of the penis, it tends to keep collecting and collecting. And if every time that you take a bath or you have sexual activity, you do not push back the foreskin and wash,
Yeah.
it'll keep collecting, and then it causes a condition called phimosis, where constriction of the glands happens. And so then you need to treat. All these things are absolutely not needed and should not be done.
Not okay. So I think out of this live, I understood. I think condom, water is the only thing which can keep you. You can just clean yourself with water and use condoms. That's all is needed. And do not share your toys. Yeah, and do not
share.
That's
do not share underwear. Do not share all your personal items, basically.
Okay. And doctor, there's a question coming from the audience that one person said, if the person is allergic to condoms, and what can be, if this person says if the woman is allergic to condoms, what to do then? I mean, is there any other way for
see, a condom is made out of latex. Okay, latex is a very hypoallergenic thing. So it's very, very, very rare that someone can be allergic to latex. Okay. The irritation that happens because of intercourse with a condom, mostly the main reason is because enough lubrication of the vagina does not happen. And in a dry vagina, if you put in a condom, if you put in a penis with a condom, it will cause irritation. So it's not really allergy to the latex of the condom. It's rather because the woman is not lubricated enough. Do you get my point?
Okay. Yes. And also there's one question regarding, is it normal to have dry skin on vaginal area during periods? Is it very normal to have dry?
During periods you use a pad. So the pad has there are many people who nowadays are allergic to the substance by which the pad is made. And that causes all those rashes and itching. The ones who have something very mild will only have itching after their period. You constantly feel like putting your hand there and itching. The ones who are severely allergic will develop a rash. Because the period lasts only for 4 or 5 days. After that, once you stop using the pad, it will reduce. But then in the next cycle, again it will happen. So it's basically it's not exactly dry skin, but it's the skin reacting to the chemicals of the sanitary pad.
Okay. And we have one more person because we are out of time. So I'll just take the last question. It's regarding, I think, which period product do you recommend to use? Menstrual cup or cotton pad? Which one do you think?
It's a personal choice thing. I am all for cotton pads because they are reusable. But menstrual cups, I have 2 or 3 patients who are very happy with a menstrual cup. The only thing is that you need to remember to take it out and wash it and before. So it has happened, that especially with tampons also. I forgot to mention tampon. You insert it and a woman has forgotten that she's inserted it. Then you're in trouble.
Yes.
Right? Because it's supposed to be every 4 to 6 hourly, you remove it. And menstrual cup also needs to be removed every 4 to 6 hourly according to the flow and needs to be washed. So it's a question of personal choice. But both are good.
Okay, both are good. Okay.
Visible, environmentally friendly. What more can we ask for?
Yes. So, doctor, we have completed our time, and thanks a lot for coming live and talking to the young people about sexual hygiene. And the takeaway from this live is, I'm repeating again and again so that people who are watching us and listening to us understand, and it's very simple. I mean, using condom, using water. Water is there at home right now.
Yeah.
Lockdown is there, but water is there, thank God. So the basics are there with us. So we can just take care of us through water and condom. And a lot of us spend a lot of money on this vaginal wash, which is not required. And we don't need it.
No.
Yes. So just stick to water and Yeah, that's all how we can keep ourselves clean and hygiene. So thanks a lot, doctor, for coming live, and thanks a lot
Welcome.
making our Friday very interesting. So thanks a lot again.
Thanks for having me.
Thank you, doctor.
Okay.
Thank you.